Mr. Nicholas Brook from the Break Dengue Alliance, and precisely a group that is bringing together all the different actors, specifically on the dengue arena. So perhaps we might be able to hear from you first, since you didn't have a chance to make a presentation, about how would you view, in practice, bringing together all these actors and bridging the gaps.
Thank you. So basically, my peers here have explained the problem quite well. So far today we have been discussing about vector control, but the bigger picture explained by Dr. Raman, this is more, there is a diagnostic issue, there is a vaccines issue, there is all the education part. And so based on the same keyword that you mentioned, coordination and collaboration, and based also on some people, the change management, the agent of change that Patrick described earlier. I'm here because I represent an initiative from industry, people from the industry. And basically they wanted to, since there is no silver bullet against dengue, they wanted to create this alliance and bring together all the different partners. And so the idea is to make sure that we map all the key players, all the initiatives, all the solutions against dengue, and we make them work together. So the Break Dengue Alliance is together funded by Bayer and Sanofi Pasteur, and the idea is to bring together many other players who have a board of scientists that could identify these zillions of initiatives in each country and make sure that we can identify the good one and then bring them to the global scale. So that's basically why we are there, and I'm looking forward for more contacts. So we have started, we exist for 2 months. We have a Facebook page with 1,000 likes a day, and we are very successful, and it really illustrates the demand and the need from the people. Just maybe one last thing to comment on the keyword analysis that Patrick describes earlier. We also use the same raw data that Google makes available to everybody, and we use it in a different way to try to understand where dengue fits in terms of needs. So we have every month in English at the global scale, we have hundreds of thousands of search around dengue. And basically, it doesn't fight with the other neglected tropical disease. It fights with the flu, it fights with hepatitis C or B, but it's way over the other neglected disease. So basically, the trend that you explained in terms of malaria going down and dengue going up, that's something that we have seen, and the need of dengue expressed online is more important for already 5 years. So that's really something we can measure. There is certainly a correlation between what we can observe online and the reality. We have to fine-tune and identify the margin for error, but there is a huge potential for that. So I invite you to go on our website, braindengue.org, and look at the barometer to see how we can use this digital data. Thank you.
And I'm assuming if you are looking for partners, there's also a little bit more detail in the conference handbook, and all the contact details are there. So anybody actively involved in dengue, please do get in touch. Now I will turn to you and ask if there were any comments or questions which you would specifically like to raise to our speakers, or either on this session or as a wrap-up of the whole day. We're also looking for a few points to take home on concrete actions and concrete steps. We've heard a lot about reinforcing and improving the surveillance, advocating for this to be really entrenched in EU agendas, and also for it to be uniform across countries in different regions. So steps like that, and if anybody has a question, please do raise your hand.
It's been clear from this afternoon that monitoring, surveillance, coordination, collaboration, data monitoring is key. And yet, as far as I can see, at the moment, it is going further and further down the priority list of our political masters. How do we advocate, and who do we advocate to actually get some resources back so that we can actually do what's necessary?
Well, perhaps some of our policy people would like to answer that one. Raman and Paula.
The challenge, it is definitely a challenge. The question is how the advocacy has to work. Now, as I see it, as I've shown you, the regions of WHO are calling for action, and as from probably within the next 1 year or so, there is going to be a complete shift in the way that organization is going to work. We are going to listen more to the country's needs. So this is going to be the urge of the countries. So I look towards a time when many countries are going to say we need more resources, we need more allocation to come for dengue, and that will set the ball in motion. And having said that, the partnership is a key also. So we are beginning to see the infancy of a partnership developing, and we really need to see how this is going to bloom over the next year or two, and see how the partners can work together in a very transparent and cordial manner. So that is going to play a key role. But at least at the political level, we are on a good footing. Things are moving in the right direction.
I can talk about the local aspects with this outbreak. Unfortunately, when you have this kind of situation that has an impact on tourism and one of the most important economical sources for a specific region, then it's very easy to get political commitment and further economical investment. Is when you have the problem by the door, I'm sorry to say. But creating partnerships and the intersectoral advocacy was within this, because it will affect other sectors very, very fast. And the raising is always when you have the media attention, when you have people asking for solutions, when you have someone reminding that the flow of tourism and passengers will be less. Unfortunately, that's the key message we can, when you have the problem. But the problem in Madeira also raised the EU awareness that is very close. So the problem is not in endemic countries, it's not with the tourists coming, it can really be next door. And that, I think, it's a key message.
And if I can maybe just add, from the partnership point of view, we are in contact with the WHO and with many organizations, and there is never a problem of awareness or intention. It's more a problem of how to drive force together and have impact on the field. So there's a consciousness out there, and we try to leverage that. And it's more about how we'll fund that. And one of the goals of the Break Dengue is to offer, we talked about crowdfunding this morning. There will be also a system of grant that we'll put in place for projects. So that's really, we will try to empower good initiatives, including funding of them.
I think we can take one more question, if anybody volunteers. Other than that, yes?
You were talking about increase in popularity and getting information about dengue. How long do you think it will remain a neglected tropical disease for?
Oh, sorry? What?
Do you think it will remain neglected over the future, or do you think it will?
Well, with the data that we have on the barometer, it should not last very long. Generally speaking, we have the consciousness is out there. As I said, we just had recently the only negative decision on that aspect was the decision from the Dengue Alliance not to consider dengue as a priority disease with needing a vaccine. But for all the other aspects, it has been back on the radar of all the institutions. So I would say that apart of a couple of hiccups, it's going the right way, and it's not a neglected disease.
More 2 or 3 outbreaks from, I'm sorry to say.
Well, I think we're nearing the end of our time, unfortunately. I would just like to reiterate that we've had the participation of Google on the occasion of this conference, and definitely don't hesitate to get in touch, because there is a wealth of data, wealth of resources. The same Professor Simon Hayes been involved in so many different mapping groups, and across a wide section, again, of all this data which we really need in order to evaluate and churn out proper and sustainable surveillance. So do continue the discussion. once the conference is over. In the last minute, I would like to have a slightly cheesy moment and officially launch the website for next year's ISNTD Bites. Don't know if it will be put on screen now, but it definitely exists. Yes. Bit of galactic travel, and we're there. So if you are interested to participate or to speak, don't hesitate to get in touch, and we will definitely be circulating our action points and hopefully moving this community and network a little bit closer and engaging in more tangible partnerships after the outcome of this day. So thank you very much for everybody's participation. Thank you for your time. And please keep in touch until next year. Thank you.